people really believe addiction is a disease? Just let's start there. So a substantial percentage of you, and some of you raised your hands and don't believe it, and some of you didn't raise your hands. So that's about right. So what I'd like to do is just take a few minutes and write up on the board what you know about addiction. If you understand addiction, or if you know some things about it, just sort of tell me what addiction is. If you wanted to come up with your own self-taught definition. Now the doctors they spoke up, so you're going to have to. Don't be shy.
Progressive.
Progressive. Okay? Progressive gets worse over time. I'm not doing it myself. Come on, say something.
Chronic.
Chronic.
Lasts throughout your life.
Yeah, it never goes away. So like cancer, if you have the diagnosis, the disease of addiction, you will have it until you die. Okay, so like that.
Well, I was just wondering if maybe you could talk a little bit about what a disease is.
I'll make you a deal. I'll do that if you give me a characteristic once I do that. A disease is a process that negatively affects the body's structure or function.
Well,
It could be cells, it could be organs, but it's a process that affects the body, the way we're made, and the way we operate in the world, in essence. So cold affects mucous membranes of the nose and the throat and the lungs. Signs and symptoms of a cold might be coughing, congestion, kind of like I have this today, you know. Diabetes affects the pancreas. You know a lot about the disease of diabetes. Blood sugar is wacky because of it. So the signs and symptoms might be thirsty and hungry and weight loss and confusion if the blood sugar goes too low. So that's the definition of the disease. Go ahead.
well, all I was thinking was that it obviously seems to affect different people different ways.
Okay?
At some biochemical level, and I don't.
Okay, that's good. So there's a biochemical basis, and there's a lot of variation of how that disease manifests in different people, based on a lot of different variables. That's good. More.
It's injurious.
Injurious. Say a little bit more about that, or anybody want to add to what kind of, you know?
It can be, at least depending upon addiction, physically debilitating.
Okay,
and
so it injures the body.
injures the body, and also affects, I think, cognitive function.
So brain function, thinking, judgment.
And emotional stability.
Okay. So there's a lot of emotional instability associated with the disease of addiction. More of the injurious nature of the disease.
Affects the whole family.
Yeah, definitely affects the family. And not only the family, it affects job, it affects us, you know, those of us in the public sector, let's say, who are working with people. It affects the criminal system. What else?
There's an inability to stop without treatment.
Inability to stop. And I'll just expand on that and say there's an inability, because a lot of people stop all the time, often. It's an inability to stay stopped. So that periodic use, alternating with abstinence, has to do with relapse recidivism. Good. Okay, more? A few more and then we'll get to the meat of what I... What else do you know about it?
It tells you you don't have it.
Yeah, so it's characterized by defense mechanisms. The most prominent is denial. Name some other defense mechanisms. And I don't mean, you know, criminal defense.
Rationalization.
Yes. If you had my husband, wife, job, boss, financial woes, you would have to do what I do. What else?
Deceit, lying.
Lying, or the lying light, is minimization. I don't have that much more problem. It's not that bad. I only drink one or two quarts, you know. What else? There's a phenomenon called projection. There's a victimized state and a projection. Okay? Say more.
Hiding, isolation, secret.
This is a disease that's based in secrets. Yes. So, I think we're getting closer to the problem about why it's hard to understand this as a disease. Diabetes, high blood sugar. I can do a blood test, I can make a diagnosis, we can stress your pancreas to see what's wrong, and we have medication to treat it. Heart disease, you have a heart attack, you get plugged arteries, maybe you smoke and maybe you eat wrong, but basically we see the disease pattern, we do what we have to do, we open up your arteries and we treat it. Addiction, we're dealing with lying, cheating, and stealing. So it's hard not to say, these are bad people. Anybody tempted to say that? You don't have to raise your hand, I know you are. So that's really part of the real underpinning of the difficulty of understanding this disease, because the behaviors are the symptoms of the disease. Everybody see that? So what's the difference between being addicted to painkillers and just really, really liking them a lot? Or the person who said, I don't have addiction, I have dyslexia. The bottle says 1 every 4 hours and I take 4 every 1 hour. There is that amount of denial and rationalization and minimization that is about promoting the continued use of substances despite really bad things that happen in people's lives and people's bodies and in their function in the world, which sort of fits the definition of the disease of addiction. Okay? So the key elements of the disease of addiction are first compulsive use, which you've already described. Compulsive use meaning I keep doing it in a way that has no logic and no reason. Anybody have compulsive behaviors other than my friend Laura? You all know what that is. Could be eating, could be biting your nails, could be what?
Shopping.
Shopping. Could be studying, could be talking, could be multitasking. We'll see how your attachment to your phones are over the course of the day. That's pretty compulsive behavior. And some people do it, and they know it's really not the right thing to do. It's kind of rude to be sitting there on your cell phone. And I do it fairly regularly. I mean, I'm tempted to do it now, just mentioning it. So, compulsive. I'm not gonna. I'm just going to check the time. That's the only way to Oh, excuse me. No. The key characteristic of the disease of addiction is loss of control. And loss of control means when I start, I can't predict what's going to happen next. So it's not a quarter day, it's not even daily use. It's when I start, things change, and I end up doing things I don't want to do, which is I use more than I want to, I end up behaving in a way that's badly, including breaking the law and breaking people's hearts. I end up in a plane in Salt Lake City in jail, and I have no recollection of how I did that. So, loss of control, a cardinal symptom of addiction. Continued use despite harm, you're pretty much what we're talking about with all these things that are injurious to our body and to our lives and to society, and yet we keep doing it. And then the last characteristic is the one that really underscores the relapse and recidivism, which is in the absence of the drug, it just seems like a really good idea to look at something. Despite all the stuff I know, despite all the promises I've made, despite all the logic and reason I've ever been able to muster, and it sounds a little like, wasn't that bad. I don't think they're going to check my urine until Tuesday. It's only Sunday. I mean, I have people, I work with kids in the drug court, Judge Kearns, he thinks he's a doctor, but runs Yo Court, which is Youth Offenders Court. And, the parents of the kids in that court come and see us in our family program. And one particular case is Cindy. Cindy knew she was going to go to jail if she had a positive urine, and she used that morning. She used heroin that morning. Now, what is that about? that's pretty compulsive. Sort of using despite consequences. And you ask Cindy, what were you thinking? And she says something really crazy like, I thought I could get away with it. Well, every time you go to court, she ended up loaded in Judge Kern's court. He's a pretty sophisticated guy. So I really want to talk this morning about what it is that allows...
Judge Kern's is sophisticated.
He can tell when somebody's loaded. Let's say it that way. She said, you know what? I can do a couple days. It's no big deal. I really felt so bad. I was so stressed out. I just needed to do something. I couldn't go into that court without it. That was Cindy's explanation. I felt inhuman. I felt unalive without that drug. I was lost. I didn't have a sense of myself. So that's the drive that we're up against. It's pretty powerful. So this is one definition of addiction. I'm going to show you 3 over the course of the morning. The second comes from the DSM, Diagnostic Statistical Manual. It's the American Psychiatric Association book, big book, and it defines all psychiatric illness. Now, DSM-5 is coming. This is the 4th edition. DSM-5 will be out in 2013, and it's going to change things, and I'll tell you a little bit about what the changes are. But the real key characteristics of the disease, let me tell you first, the addiction is not in the DSM. Because when they wrote the DSM, they said, oh, addiction's a bad word, it's pejorative. We don't want to list that as a diagnosis. So the diagnosis is not addiction, it's drug dependence. That's the diagnosis that anybody who has this disease has in current nomenclature, which is really dumb because, as you see, the second characteristic of drug dependence is drug dependence. So it's both the symptom and the title. So I think of it as addiction, and the DSM-5 will have the term addictive disorder, and then it will be substance use disorder for the specific substance. But the first 2 characteristics are physiologic. One is tolerance, which means that I need more and more to give me the desired effect. And the second is when I stop, I feel bad. And those are key characteristics that promote use and continued use. The third is this loss of control phenomenon, which is I use more and longer than I plan, and I have tried to quit or control my use and I can't. So those are 2 characteristics related to that loss of control phenomenon. The 5th is time spent or preoccupation with using, which really defines craving. It's gone, and that's all I think about. Or, I just, it's getting hot today. I think a nice beer would be good. Did Paul say beer was on the list of things I can't drink? Of course he did. But that doesn't matter. So the craving just sort of niggles in. A lot of people who have the disease of addiction dream about using, and they'll report that. And then the last 2 are about consequences, reducing or abandoning important work, social, or leisure activities because of substance use, and continuing to use despite adverse medical or psychological consequences. Now, DSM-5 is a little more complicated. They've decided that the term drug abuse doesn't really apply. So they're abandoning the term abuse. Abuse, and I'll tell you why, and it's probably logical. They've done all this they try to do it based on evidence, but there's a new article out there that is demanding that anybody who's making diagnoses has to disclose their affiliation with drug companies. So we're going to see some pretty interesting, it was just out in the headlines today, some interesting incentives for how diseases are diagnosed. Because, especially psychiatric illnesses, if you're a consultant to Prozac, you want to get more people diagnosed with dysthymia, which gets you into the depression category and justifies medication use. In the case of abuse, however, drug abuse doesn't necessarily automatically mean somebody's going to have this disease. It doesn't seem like everybody goes from abuse to misuse to hyperuse to addiction. So there are some people, and you may be one of them, who partied hard, maybe in college, and then you got a DUI. Probably nobody in this room, but or you got threatened with divorce, or maybe your relationship ended. And what did you do in response to that? You said, you know what? This is bad for me. I'm not going to do this anymore. That would be diagnosed as abuse, but you don't have the disease of addiction. On the other hand, there are people who have 3 DUIs, and you know what they do? They drive on the side streets because you guys who have guns hang out on the highways. And I had one woman, she said, after my 3rd DUI, I knew exactly what to do. I sold my car.